The way you sleep is damaging your spine, restricting your brain, and making your pain worse every single night. Most people spend enormous effort in choosing what they eat, how much they exercise, and which supplements to take. But there is one thing every single person does for 7 to 8 hours every night that receives almost no attention, and it is silently compressing spinal discs, restricting brain's detoxification system, and converting what should be body's most powerful repair window into a source of cumulative damage. That thing is sleeping in wrong position, and the most important word there is cumulative. The damage does not happen in one night. It happens very slowly, invisibly, one night at a time, until chronic neck pain, morning stiffness, wrist numbness, or persistent fatigue becomes the new normal. And the cause is never identified because nobody thinks to ask about sleep position. Think about how much effort goes into an average person's attempt to sleep better. A new mattress, a specific pillow, melatonin supplements, chamomile tea before bed, blackout curtains. Indians collectively spend thousands of crores annually on sleep-related products, and the sleep disorder burden in India, which AIMS estimates affects over 93 million people, continue to rise despite all of it. The reason most of these interventions produce only partial relief is that they address the environment around sleep without addressing the single most important variable inside it: what the body is actually doing for these 7 to 8 hours. A mattress cannot correct what a position destroys. A pillow cannot undo the nerve compression that happens when the arm spends the night raised above the shoulder. No supplement can compensate for a spine that is being loaded incorrectly every night while the body is trying to repair it. The interventions are not wrong. They are simply targeting the periphery of a problem whose center is positional. And because sleep position is invisible, habitual, and never assessed in a standard medical consultation, most people carry the consequences of a harmful sleeping position for years, accumulating damage one night at a time without ever identifying the cause. In this video, I want to explain 4 sleep positions that are causing harm in ways most people never connect to their daily symptoms, explain the biology of what actually is happening at the spinal, neurological, and cellular level in each position, and then give you the complete corrective method and the science behind why it works. But first, let's understand why sleep position matters more than most people realize. Sleep is not passive. While you're unconscious, the body is executing an extraordinarily complex series of biological repair processes that depend entirely on physical environment the body is placed in. Spinal discs, which have no direct blood supply and receive their nutrients through a process called diffusion from surrounding tissue, rehydrate during sleep. This rehydration requires the disc to be decompressed, meaning the spine needs to be in a neutral, non-compressed position. Muscles relax and release accumulated metabolic waste. Inflammatory cytokines are cleared. And most importantly, this system called the lymphatic system was discovered in 2012 and represents one of the most significant findings in the neuroscience in recent decades. The lymphatic system works by circulating cerebrospinal fluid through the spaces between the brain cells, flushing out metabolic waste products that accumulate during waking hours. The most significant of these waste products are beta amyloid and tau proteins, which, when they accumulate, are directly associated with Alzheimer's disease and other neurodegenerative conditions. Research published in Nature Medicine showed that lymphatic activity during deep sleep is up to 9 times higher than during wakefulness. A 2021 study from China involving 17,000 participants found that poor sleep quality was associated with a 32% higher risk of cognitive decline. And critically, the efficiency of this lymphatic clearance is directly affected by sleeping position. The cervical spine, the 7 vertebrae of the neck, is particularly vulnerable during sleep. This region houses the upper position of the spinal cord. governs the nerve roots that supply the arms and the hands and controls the blood flow to the brain through the vertebral arteries. The neck has a natural forward curve called as cervical lordosis. When this curve is maintained during sleep through proper support, pressure is distributed evenly across the discs and facet joints, nerve roots remain uncompressed, and blood flow continues without restriction. When the curve is distorted through poor positioning for hours at a time, the consequences accumulate at a rate most people never anticipate until the symptoms have been present for years. Now let's talk about 4 sleeping positions that are destroying your body every single day. And number 4 is sleeping on your stomach. Stomach sleeping is the position most consistently associated with cervical spine damage in the clinical and biochemical literature, and it does this through a mechanism that is straightforward once it is understood. To breathe while lying face down, the head must rotate to one side. Most stomach sleepers rotate predominantly in one direction and maintain this rotation for majority of the night. The rotation angle is typically between 45 and 90 degrees from the neutral position. This means the cervical spine is held far outside its neutral zone for 7 to 8 hours continuously. Punjabi's foundational research on spinal stability, published in Journal of Spinal Disorders, established that the passive structures on the spine, including bones, discs, and ligaments, provide stability only within a narrow neutral zone near each joint's resting position. Outside this zone, the active muscular system must provide support. During sleep, that muscular system is fully relaxed. This means the passive structures, specifically the facet joint capsules, the anterior longitudinal ligament, and the discs themselves are bearing sustained rotational load without any of the muscular support that would normally distribute that stress. Night after night, this produces asymmetric compression on the compressed side of the neck and sustained stretch over the opposite side, which over time translates directly into facet joint irritation, disc degeneration at the posterior annulus, and progressive loss of cervical range of motion. The lumbar spine suffers equally. Stomach sleeping flattens the natural inward curve of the lower back, called as lumbar lordosis, and the body weight pressing through the abdomen and pelvis pushes the lumbar spine into extension. This compresses the posterior facet joints and increases the pressure on the posterior annulus of the lumbar discs. In individuals with any existing lumbar disc degeneration, stomach sleeping reliably worsens the condition over time, and the diaphragm, the primary muscle of breathing, is compressed against the mattress in the prone position, reducing lung expansion and oxygen intake with every breath throughout the night. For people who have slept on their stomachs for years and find the position deeply habitual, the transition requires a specific strategy. Placing a firm pillow under the pelvis, not under the abdomen, reduces the degree of lumbar extension. Using the thinnest pillow available for the head or no pillow at all reduces the rotation angle in the neck. But the target is to eliminate stomach sleeping entirely, and the most reliable technique is using a full-length body pillow on one side that makes rolling face down physically uncomfortable. Position number 3 is sleeping with arms raised above the head. This position is extremely common and extremely under-recognized as a source of chronic symptoms. Many people sleep on their back or on side with one or both arms raised above the head, sometimes tucked under the pillow, sometimes simply extended overhead. The position feels comfortable initially because raising the arm above the head creates a brief decompression sensation in the shoulder. But what it does actually over the hours is produce progressive compression of one of the most important nerve networks in the body. The brachial plexus is a network of nerve roots emerging from cervical spine and passing through the thoracic outlet, a narrow anatomical position between the collarbone and the first rib, before traveling down the arm to supply sensation and motor function all the way to the fingertips. When the arm is raised above the shoulder for extended periods, the brachial plexus is stretched over the first rib and the thoracic outlet narrows. compressing both the nerve network and the subclavian vessels that supply the blood to the arm. Research on thoracic outlet syndrome consistently identifies arm elevation above the shoulder height during sleep as a primary provocative position for brachial plexus compression symptoms. The consequences are the same sensations people commonly describe as their arm or hand falling asleep overnight. That pins and needles feeling, the numbness that requires shaking out the hand on waking, the weakness in the grip that is present first thing in the morning. These are not the sign that arm is just simply resting awkwardly. They are the signs of nerve compression and reduced arterial flow that, when repeated nightly for months or for years, produce a chronic irritation pattern that persists through the day. People presenting with carpal tunnel-like symptoms, chronic shoulder pain, or persistent hand weakness often have this positional compression as a significant contributing factor, and the symptom resolution when the arm position is corrected is frequently faster than any other intervention. The correction requires keeping both arms at or below shoulder height throughout the night. A body pillow position in front of the chest provides a natural resting surface for the top arm inside the sleeping and prevents the arm from drifting overhead during sleep. For back sleepers, arm should rest at the side with a small pillow under the forearm to prevent them from migrating upwards unconsciously. Position number 2 is sleeping completely flat on the back. Back sleeping is widely described as beneficial for the spine, and it can be. Lying supine distributes body weight evenly, minimizes pressure on vertebral discs, and keeps the head, neck, and spine in relative alignment without rotational stress of stomach sleeping. These are genuine advantages. The problem is back sleeping on a completely flat surface with no elevation. When the head and torso are at the same level as the legs, gravity pulls the tongue and soft palate posteriorly, partially obstructing the upper airway. This is the primary physical mechanism behind snoring and obstructive sleep apnea. In obstructive sleep apnea, the airway is repeatedly partially or fully blocked during sleep, producing cycles of reduced oxygenation that triggers body stress response, elevate blood pressure, fragment sleep architecture, and over time independently associated with increased risk of cardiac arrhythmia, hypertension, and cognitive decline. Research published in American Journal of Respiratory Medicine found that seniors who sleep completely flat have a significantly higher incidence of sleep apnea symptoms compared to those sleeping with even slight elevation. The second consequence of the flat supine position is acid reflux. The stomach sits below the esophagus when the body is upright, and the lower esophageal sphincter maintains a pressure barrier that prevents gastric contents from flowing upwards. In the completely flat position, this gravitational advantage is removed and the sphincter alone must resist reflux. In individuals without any degree of gastroesophageal reflux disease, which affects a substantial proportion of the adult population, sleeping flat reliably worsens nocturnal acid exposure. Waking up with a sour taste, morning hoarseness, or a burning sensation in the chest at night are all signs that flat position is allowing reflux during sleep that the body cannot clear. The correction for back sleepers is elevation rather than position change. Elevating the head of the bed by 15 to 20 centimeters using blocks under the bed legs or using a wedge pillow that supports the body from the hips to the head in a gradual incline rather than simply propping up the neck simultaneously reduces the upper airway collapse, positions the stomach below the esophagus, and improves venous return to the heart. The incline needs to begin from the hips. Propping only the head and the neck creates a sharp bend in the mid-back that introduces its own pressure problem and does not achieve the respiratory or digestive benefits of a true full body incline. At position number 1 is extreme fetal position. Side sleeping is one of the most physiological beneficial sleep position for most of the adults, and the evidence for this has strengthened considerably since the discovery of lymphatic system. A landmark 2025 study published in the Journal of Neuroscience using advanced MRI imaging demonstrated that lateral sleeping positions are superior to supine or prone positions for brain waste clearance. Left side sleeping in particular shows additional advantages for digestion, as stomach's natural anatomy means that lying on the left positions gastric contents lower and reduces the acid exposure time in the esophagus. The inferior vena cava, the large vein that returns blood from lower body to the heart, runs slightly to the right side of the spine, meaning that left side sleeping does not compress this vessel and supports unobstructed venous return. Side sleeping, therefore, is the recommended position. The mistake is the degree of spinal flexion on the side lying position. Many people, particularly those experiencing low back or hip discomfort, instinctively curl into a very tight fetal position with knees drawn upwards towards the chest and the chin tucked towards the sternum. This position provides temporary relief because spinal flexion opens the neural foramina, the small opening through which the spinal nerve roots exit the vertebral column, which reduces pressure on compressed nerve roots momentarily. The problem is that this relief is conditional on the position being brief. When the extreme fetal position is maintained for hours, the different structural problems emerge. The thoracic and lumbar spines are held in sustained flexion, stretching the posterior ligament and posterior disc annulus throughout the night. The hip flexor muscles, specifically the psoas and the iliacus, are maintained in a shortened position that progressively reduces their resting length. The chest is compressed, reducing lung expansion, and the cervical spine, depending on pillow height, is often pushed into lateral flexion that creates its own nerve root loading. Research published in European Spine Journal found that habitual extreme fetal position was associated with significantly higher rates of chronic thoracic spine pain and hip flexor tightness that limited daytime mobility. The target is side sleeping in a supported neutral position where the spine remains in a neutral gentle curve rather than a forced flexion. 3 contact points determine whether this neutral position is maintained. The pillow under the head must fill the gap, the ear and the mattress precisely, which depends on the shoulder width. A pillow that is too thin allows the head and the neck to drop towards the mattress, creating lateral cervical flexion. A pillow that is too thick pushes the head towards the opposite shoulder. The goal is for the ear, shoulder and hip to form a straight vertical line when lying on the side. The second contact point is a pillow between the knees. Without this, the top leg falls forwards and downwards under the gravity, creating torsional force through the pelvis and lower back that accumulates over hours. The pillow between the knees keeps the hips stacked and the pelvis neutral and the lumbar spine untwisted. The third contact point is a pillow in the front of the chest. This prevents the shoulder from collapsing forwards into internal rotation and keeps the brachial plexus at a neutral angle. Ayurveda describes the left lateral position as the most favorable for sleep, calling it Vamakushi, meaning left-sided lying, and connecting it specifically to improve digestion and the movement of prana through proper channels. Modern physiology now identifies the anatomical reasons for this. The stomach's neutral position on the left, the cardiac anatomy, and the drainage pattern of the lymphatic system all support the left-sided preference. The wisdom preceded the mechanism by centuries. So now, what is the complete corrective method for best quality sleep? The supported left side lying position is the most beneficial sleep position for the majority of the adults. Pillow configuration, bed surface and transition period for people changing long-standing positions. For pillow configuration, the head pillow needs to match shoulder width. Side sleepers with broad shoulders need a thicker pillow, typically 12 to 15 centimeters. Memory foam or latex pillow that hold their shape under the weight of the head are more reliable than soft pillows that compress flat within minutes. The knee pillow should be thick enough to keep top knee level with hip and not so thick that it pushes the knee above the hip line. The chest pillow should be long enough to support the entire top arm and the shoulder height. The mattress firmness matter because both extremes undermine positioning. A mattress that is too firm creates the pressure concentration at the shoulder and hip without allowing the body to sink slightly into its natural contour. So this was about today's video on the right sleeping positions. So it might take a bit longer for you to adjust to it and make this change happen, but it is for the best interest of your body and your physiology. Also, if you're someone who has diabetes, sleep is one of the most important factors that is going to help you reverse diabetes, and that is exactly the name of my third book, that is Reversing Diabetes, which is live on Amazon now for pre-orders. So go and get your copy of the book. And as we always say, it's never just a diet, it's always a lifestyle. So stay healthy, stay fit, stay grateful, and stay blessed.